COVID-19 cases are on the rise this summer across the country, including right now, right here in New Hampshire.
We're joined now by Ashley Conley. She is the Executive Director of Quality, Patient Safety, and Infection Prevention for Catholic Medical Center. And Ashley, what are you seeing in New Hampshire when it comes to COVID infections and the number of COVID infections?
So similar to some other summers, we are starting to see an increase here at CMC, both in our hospitalizations coming in our urgent care and our primary care practices. So we're definitely seeing a little bit of that uptick right now.
And now, Ashley, I read, I think it was in the Times yesterday, some folks were saying that a lot of them thought they just had allergies or a cold or sniffles, and it turned out it was actually COVID. So is there a new variant that's out there, and are we seeing anything different in terms of the symptoms or symptom profile?
Yeah, so every few months, we start to see this little bit of change in the variants that are out there. So we have seen a little bit of a change over the last few months. And a lot of the symptoms are like many other summer viruses that people get, or those allergy symptoms that start up. And so, that's definitely something people might think, oh, I just have allergies or some other cold, and they test themselves and it ends up being COVID.
And speaking of testing, should people still be testing themselves if they have those kinds of symptoms? And what should they do with those results? I mean, for a while we had, you could report those results to the state. That program ended. So should people still be testing themselves?
Yeah, so a lot of people are not testing as much as they used to, right? And I think the really important piece is if you have any symptoms at all of a respiratory virus, that you're doing what you can to try and prevent the spread of that. Because even if it's not COVID, it might be something else that we don't want to share, especially if somebody has a low immune system or they're caring for a newborn or those other high-risk populations. But those tests are available, and there are instances where you do want to test and see if you do have it, especially if you have chronic conditions where you might need some help from your doctor in treating.
And let's talk vaccines here. A lot of folks got the initial ones, some boosters, and I know the FDA has come up with the new guidance about when they think the timeline should be. So we're heading into the back to school season. A lot of people associate the flu shot with the fall. When should people be thinking about a COVID shot?
Yeah, so for this fall, think about your flu vaccine and your COVID vaccine at the same time. They'll both be coming out right around the end of August, early September. And now we're changing that mindset. So if you're going to get your flu vaccine, think about getting your COVID vaccine. It has been updated. So the one that will be available this coming fall, it is recommended that anybody 6 months or older definitely considers getting that vaccine.
Now, if you do have COVID, if you test positive, what should you do?
Yeah, similar to other things that cause respiratory viruses, if you get a fever, you want to wait 24 hours till that fever's gone. And that's without taking medicine to reduce that fever. After that point, as long as your symptoms are getting better, you can start to resume normal activities, but you want to be careful for the next 5 days. That's about the amount of time where you could still be spreading it to others, especially if you live with somebody that has a weak immune system or, again, they're a high-risk individual.
All right, great advice. Ashley Conley, we appreciate you joining us here today. Thanks so much.
Thank you.